Did you know that the first advances in wound care began with the work of Ignaz Semmelweis in the 19th century? He is a Hungarian obstetrician who discovered how hand washing and cleanliness in general in medical purposes can help prevent maternal death. Today, we are going to talk about how to do first aid treatment on cuts, scrapes, and punctures. When we go back to the curtains of the past, the earliest records of wound healing techniques date back to 2500 BC from ancient Egypt. Wounds were believed to have a spiritual component back then, and so part of the healing process involved using donkey feces to ward off evil spirits. This actually seemed to work, owing to an antibacterial effect of the material used. As time passed, wound healing was aided by techniques that has an antibacterial effect. It includes the washing of wounds with herbs, minerals, milk, and water. Hippocrates in Greece around 400 BC described using wine or vinegar as materials needed to cleanse the wounds of impurity. But what really are the causes of cuts, scrapes, or punctures? It is well-known fact that each activity has their own set of wide-range risks and injuries that may happen, and participating in outdoor recreational activity is not exempted with risks and injuries. Wounds, cuts, and lacerations can be caused anywhere from rock climbing, cutting self from a knife, and stumbling. And what can you do to treat cuts, scrapes, and punctures? Here goes the application of first aid treatment to cuts, scrapes, and punctures. Always remember to clean cuts with soap and water, then apply antibiotic cream, then cover with sterile bandage and secure using medical tape. If bleeding, apply direct pressure using clean cloth to the injury. If wound is on the arm or leg, raise limb above the heart to help slow down bleeding. Do not apply tourniquet unless the bleeding is severe and does not stop even with direct pressure. Take into account that emergency personnel must be called immediately if severe bleeding or bleeding does not stop despite pressure. You suspect there is internal bleeding or inflammation and severe pain in the area. There is an abdominal or chest wound and blood spurts out of wound. Moreover, applying appropriate first aid treatment to a wound can speed up the healing process and reduce the risk of infection. And that wraps up our video for today. Bear in mind that from every wound there is a scar, and from every scar there is a story that says I survived.